am Alexandra Wright. I am doing the head, eyes, ears, nose, and throat assessment. I am in my Rasmussen attire with my white shoes and my badge. I'm going to knock on the door and open it and close it for privacy. I've gathered my correct supplies here. I'm going to wash my hands. I am Alexandra. I'll be your nurse for today. Can you tell me your name and date of birth?
Joshua 76, 1992.
And do you know where you are?
The clinic.
And do you know what time it is?
3 p.m.
And how did you get here?
Drove myself.
Okay. And what are you here at the clinic for?
A physical for school.
And what are you going to school for?
To be a nurse.
Well, congrats.
Thank you.
This tells me my patient is alert and oriented ×4. I am assessing his recent and remote memory. And his posture is good. And his dress attire for the clinic is good. And his mood is good. His personal hygiene, it looks like he recently showered. I see no visual deformities. His nutrition status, he looks healthy and fit for a 26-year-old. His speech and responses are appropriate for the situation. All right, Joshua, I'm going to be doing the head, eyes, ears, nose, and throat assessment on you and be checking all those out, and also your lymph nodes and your pulses. Any questions?
Nope.
Okay. I'm going to assess your head here, or palpate it, and I do not feel any indentations or protrusions. Looks like you recently showered. There's no dryness or flakiness. I am going to test for cranial nerve number 5, which is the trigeminal nerve. Can you feel this?
Yeah.
And I'm going to test for cranial nerve number 7, the facial nerve. Can you smile for me and frown? Okay. His head is normal cephalic to his body. It's symmetrical in center. I will then be assessing your eyes here. His eyebrows are evenly distributed with his face. His sclera is white. His irises are dark brown. His eyelashes are full. There is no drainage or redness or swelling. His skin is tan. He has one small 1-inch in size scar on his left cheek. All right, I will be testing for cranial nerve number 2, the optic nerve, which would be the Snellen chart. And I'm going to test for cranial nerve number 3, the oculomotor. I'm going to put my hands behind you and test for it with your peripheral vision. When I bring them forward, tell me now.
Now. Now.
All right. And then I will also be testing the 6 fields of gaze. So if you could look at my hand here and follow it. His eyes move fluently with my hand motions. That was testing for cranial nerve number 3, 4, and 6, which is the oculomotor, the trochlear, and the abducens. All right, and then can you also look at my 2 fingers here on the wall? And my 2 fingers again on the wall? Okay. That was a look near and look far test. And his pupils were responsive. And I'm going to test for perla here. Okay, his pupils dilated and constricted appropriately. Alright, and then I will be assessing his external ear. The shapes are proportionate to his body and they're symmetrical with his head. I will be, and there is a little dryness. The rumen is present here. I do not see any drainage or inflammation or any lesions. Alright, and then I'm going to touch your pinna here. Any pain?
No.
And your tragus, any pain?
No.
Okay, and then I am going to test for cranial nerve number 8, the vestibulocochlear. Can you hold your tragus for me? Push on it. I'm going to repeat a word behind you, and I want you to repeat it.
Water bottle.
Okay. And then I am going to assess your nose. Your nose is symmetrical to your face. There is no dryness or anything. Can you look up for me? Alright, lesions or any drainage or any redness. All right, I will be testing for cranial nerve number 1, olfactory nerve. And can you cover one nostril for me? And tell me what you smell here.
Alcohol.
Okay, other nostril?
Alcohol.
Okay. And then I'm going to assess your mouth here. Your mouth is dry and there is cheilitis. Can you open your mouth here? All right, I'm going to assess for cranial nerve number 12, the hypoglossal. Can you say ah? All right, and his uvula is midline, saliva is present, it is pink, there is no inflammations. Lift up your tongue, it is glistening, and I see the veins present. All right, and I'm going to assess for cranial nerve number 9 and 10, the glossopharyngeal and the vagus. Can you swallow for me? All right, and I'm going to assess your neck here. I do not see any inflammation or lesions. Your trachea is midline to your body. I am going to assess for cranial nerve number 11, accessory muscles. Can you push up on my hands? All right, any pain with that?
No.
Okay, and then can you look down for me and then extend your neck back? All right, can you look to your right and to your left? All right, and then can you push on my hand here and push on my other hand? And any pain?
No.
Okay, and then I'm going to check your lymph nodes here. I'm going to check your preocular and your posterior ocular and your tonsillar and your submandible and your submental. All right, and then I also assess your pulses here. I'm going to assess your carotid pulse. And then can you lift your sweatshirt up so I can assess your brachial pulse. And then I would assess his femoral pulse. And then I'm going to assess your radial pulse. And then your popliteal pulse. And then your posterior tibia pulse. And then your dorsalis pedis. And that concludes my assessment.